Welcome and thank you for joining us for today's electronic referrals to the Sydney Local Health District and SR Specialists and Referrals. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize the continuing connection to land, water and community and pay respect to elders past, present and emerging. I also extend that respect to any Aboriginal colleagues who might be joining us today. I would like to introduce our speakers. Our first speaker is Eric Dunn, GP Liaison at SR Specialists and Referrals. With more than 25 years in the technology industry, Eric has worked in diverse areas of information technology, digital security, with the last 8 years focused on digital health. As the digital health manager at the Sydney North Primary Health Network, Eric led 2 digital health projects funded by the Australian Digital Health Agency for specialist and aged care, led the development and delivery of the Sydney North Digital Health Strategy, and a number of digital health programs, including regional expansion for My Health Record, secure messaging delivery, and telehealth. Eric is a qualified change management practitioner interested in people-centered proactive solutions and advancing digital maturity in the wider health landscape. Eric is working with Cervin Media and SR Specialists and Referrals, implementing the expansion of eReferrals between GPs and private specialists across the country. Joining Eric will be Carmel, General Manager of SR Specialists and Referral. Paul Bennett is the Program Manager of Health Pathways Sydney and Sydney Local Health District GP eReferral project. With over 30 years experience as a registered nurse and health manager in the United Kingdom and Australia, Paul has been the manager of the highly successful Health Pathways Sydney program supporting general practice since 2013 and is also responsible for the delivery of electronic GP referral system to Sydney Local Health District hospitals and services.
So as Alex mentioned, my name is Eric Dunn and I'm the presenter for SR Specialists and Referrals this evening. I also like to begin by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander people who may be on the call this evening. Also mentioned, I have Dr. Carmel Cervin from SR Specialists and Referrals to help with the demonstration and answer questions. And we're also very fortunate to have Paul Bennett from the Sydney Local Health District to present on referring to the Sydney LHD clinics and services using HealthLink smart form eReferrals. So tonight you're going to get to see how to eRefer to both the private and public systems. Welcome, Carmel and Paul. So tonight we're going to talk about the existing referral process, how we've collaborated with other businesses to make eReferrals, how to make the eReferral process easy, why you should use SR to refer to private specialists. Then I'll hand over to Paul to introduce eReferrals for the Sydney LHD and why you should use eReferrals for hospital services. He will also do a live demonstration on the hospital smart forms. Then we'll come back to me to do a live demonstration on best practice and then to Carmel to do a live demonstration on MD, Medical Director. And then we'll have a look at what the specialists see when they receive an eReferral in Genie. The next topic is why you're probably already live with SR and how easy it is to get set up if you're not. Then a section on how we can help and an opportunity to get your questions answered. With questions, please use the Q&A button at the bottom of your screen. You can open it now and type questions as we go through the webinar. Please don't be shy with questions. Feel free to type as we go along, as there will be a thorough discussion at the end of the demonstrations. As Alex mentioned, the handouts and recordings will be sent to everyone after the event. So by the existing referral process, I'm talking about letters, faxes, and emails. With faxes, how do you know if the whole fax went through with all the attachments? With email, how do you know if the attachments got stripped out or if it went into the spam folder? Did it even go to the right person? Referrals that go to a practice where a specialist no longer works will mean spending extra time following up and sending it to the correct practice, or contacting and finding another specialist for the patient. Where do you find the specialist? How do the specialists find the referrals? Is it easier for them to just ask the GP to refax it when the patient turns up? There's a huge amount of time spent scanning paper documents, both at GP practices and specialist practices, attaching scanned documentation to patient information in the clinical system, following up that the referral has been received, and retyping patient information. I've had both clinicians and staff express to me their frustration with the time spent on administration. GPs and specialists have had secure messaging systems for years, so why no eReferrals? Well, possibly because there are multiple directories. Each private hospital has its own directory. There are paper directories and online directories. There are multiple secure messaging providers. How do you know which one is being used by the receiving specialist? Specialists move around between hospitals and practices. GPs have multiple templates for different systems for different specialists, out-of-date templates that need changing or just don't work. And you have to know all of this before you even start an eReferral. So the system is unworkable. Perhaps it's just easier to send it by fax and deal with the fallout from that. So what have we done about it? Cervin Media have collaborated with HealthLink to provide an end-to-end solution for eReferrals to private specialists called SR Specialists and Referrals. SR Specialists and Referrals is the online version of the well-known printed specialist directories, and it's been integrated into your practice software and linked to HealthLink smartforms to securely and seamlessly allow eReferrals. Here's Carmel to talk about Cervin Media and the collaboration with HealthLink.
Thanks, Eric. So yes, Cervin Media is a family business, and yes, we're delighted to be working with HealthLink. We've known HealthLink for many years, and we've had a close affiliation, and now we're able to do the matching of all the address information of the specialists with their HealthLink EDI, so that you don't need to worry about that. And when you look up a specialist in our directories and their electronic eRefer button is showing, that's when the referral will go through electronically. We are constantly updating specialist information, so on a day-to-day basis, there's updates flowing through. Because the service is live online, we're able to do that at the push of a button. And obviously, some specialists have more depth information available, and at any point they can let us know their updates, and you will see those live straight away. We have been live in New Zealand for a number of years as well, and in total we've had over 1 million referrals go through the SR service now, so it has been working really well. What else? We're obviously integrated at this stage with Jeannie, Medical Director, and Best Practice in terms of sending referrals, and on the receiving end, a wide range of specialist software can receive the SR referrals, and more are going live all the time, and so as they come on, we turn them on for you. And in relation to HealthLink, the collaboration is with their smart forms. So just like you're using smart forms now for My Aged Care and Fitness to Drive in a number of the hospitals, the SR is the same workflow, the same presentation of a smart form. So it's a really familiar tool. It's free for the GPs to be set up and have the HealthLink EDI and the smart forms coming through. And there's also no charge at the GP end. So it's a really fantastic service that's been made available to both specialists and GPs, encouraging them to, for you to be able to use the electronic tools now and just make everything easier. So I'll hand back to Eric and we'll keep running. We've got a lot to cover tonight. Thank you.
Thanks, Carmel. So why SR referrals? Well, we've streamlined the referral process from end to end. With SR, the GP sends the referral directly from their clinical software. The smart form is automatically populated with the patient's information. The referral contains all the pertinent information on the patient that can be directly imported into the specialist software. You only need to look up one directory for all specialists because it's always up to date and clearly identifies the referral pathways. There is one template for all referrals, whether they're electronic or manual by fax or letter. It meets the requirements for GP accreditation and EPIP. and you can provide the patient with information about the specialist on the spot in a format that suits the patient. For specialists, there is less printing, scanning, and data entry. The eReferral is received straight away, it's easier to find, and there is more information about the patient, which is automatically imported into their software. And it's very easy for specialists to update their information in the directory. So as the specialists transition from manual to eReferrals, you will see their updated status in your software immediately. So now I'll hand over to Paul to talk about eReferrals for the Sydney LHT.
Thank you, Eric. And just a little bit of background of where Sydney Local Health District and the hospitals RPA and Concord have been on their journey. So back at the end of 2017, as I suppose in response to a strong amount of requests that were being discovered through our Health Pathways workshops, that there was a clear need for a more robust communication process from general practice into the district in terms of referrals and other communications, that it needed to be secure. We needed to move to a paper-light and paperless position in terms of managing referrals, etc. So we set about to create a set of aims, and that was aims that would improve the patient journey with secure transmission, making sure that patients were being managed at the right place at the right time with the right pathology, diagnostics, etc., that right information. For general practice, we had to implement a system that would integrate into their standard software, and particularly the major players, Medical Director Best Practice and Genie. And it also had to be able to provide live information to that general practice, live acknowledgements, live updates of when things are changing with that referral. And also then the outcomes of triage and further information. So had to be available to the general practitioner and had to be sent straight back into their system rather than via fax or letter. For the district, the aim was to, I suppose, improve the amount of information that was coming through as part of referrals. So we got a more complete referral picture, to be able to tailor referrals that they would actually be responding to what the service needed to make a more definitive assessment of the patient at an early stage, and to improve that communication back about triage outcome, waitlist information, appointment scheduling. Next slide, please, Eric. So with those key aims, we started using HealthLink in 2018 after trialing with a couple of other eReferral vendors. And what we've found with our program so far is that we are seeing an enhanced quality of information that's coming through. Implementing with HealthLink and introducing HealthLink has made it easier for general practice in our surveys to actually provide the quality of information and the quality kind of assessment to the hospital services. I think it's one of the benefits has been there's more transparency about the patient journey and better information being relayed back to general practice. And so we've certainly seen an enhancement in communication on that referral part. And the key part was also to make sure that we were getting consistency. We have a high usage of health pathways in the local environment and across the Sydney side of the PHN. So it was vital that there was consistency in the messaging and the request for criteria, I suppose. All of that stuff that needed to be there to manage a patient successfully was also replicated within the content of the eReferral where appropriate. Next slide, Eric, please. So as I said, we commenced using HealthLink in 2018, and as of last month, we brought on service number 64 So these services right across the district, we still have a long way to go, particularly for hospitals such as Canterbury and Balmain, to bring those services on, as well as some of the additional bigger services such as neurosciences and diabetes at RPA. But as you'll see from the next slide, a lot of those are already in development. Sorry, just to go back to that next one, a couple of pertinent ones to call out, and I'll be doing a demonstration shortly about the RPA maternity form, and some key pathways that have been really relevant over the last 18 months has been the three COVID-19 pathways, particularly the COVID monitoring pathway that has being used to a high degree to provide support to general practice for patient remote monitoring with COVID. Next slide, Eric, please. So as I was saying, we have additional services coming on across the remainder of this year and into the next 12 months. The big announcement will be Canterbury Maternity at the end of November as well. So that will give us a complete package for women's and baby services across the district as well. And there'll be some new additional forms coming out at the same time, particularly for the hyperemesis and hypertension services at RPA in Canterbury. Okay, thank you, Eric. So, floating to the next one. So I'll just give you a quick overview of where you can find the HealthLink button. Next slide, please. Oh, and the next one. So for best practice, as we've already been pointed out, HealthLink is integrated into best practice, and depending on your version that you may be running practice, you can either access HealthLink through the letter writer function. So as you can see, they're marked with the 1, and which opens up to a new window, and there with the HealthLink button on the top tab there. But newer versions of HealthLink actually have the HealthLink button stand out on the initial patient access screen. So you'll go from there. And then next slide. For GME, within your tools section, you will see on that drop-down list on the left of screen, the HealthLink online. By clicking that, it'll take you through to the HealthLink portal page. And finally, next slide. For medical director, you will see across the, well, it's not the top bar, that middle bar, the HealthLink tab on there. And by clicking on that and accessing a new form, you'll be able to then to reach out to make new referrals. And next slide, please, Eric. And finally, for the My HealthLink portal users, and particularly of relevance to our allied health practices, we have a significant amount of opticians that refer to our 2 ophthalmology departments, as well as general practices that are traditionally paper-based are using the My HealthLink portal as a secure web access to launch referrals in as well, and that just goes through the letter writer part there to launch those referrals. Next slide. Okay, and I will just share screen. So depending on the practice software or the My HealthLink portal, you will find yourselves landing onto this page. So you will see the SR Specialists Referrals at the top part. Underneath that, based on your geography, you will see referred services. And now this is our test environment. So there are a lot of services on here that you will never see in your practice setup, such as South Australia Health, for instance. The major ones that are relevant to Sydney Local Health District and Central Sydney will of course be the Chris O'Brien Lifehouse and Sydney Local Health District. And on that, you will find referral forms to 63 Sydney Local Health District services. So all of your general surgery, general medicine type ambulatory care services we'll find on there. And the ones I'm going to highlight today, slightly differently, are the Sydney Local Health District Women's Health Services. And this is where you will find the maternity referral form. Just wait for the internet to catch up. For Royal Prince Alfred. Once we bring Canterbury on board, this will sit under this list as well. Also on here is fertility at Royal Prince Alfred Hospital and gynecology services. That's benign gynecology services at Royal Prince Alfred Hospital. So once you find yourself on this page, you've selected your service that you want. And with this one, it's defaulting to RPA at this point in time, but you will eventually get the choice between Royal Prince Alfred and Canterbury Hospital. Once you've made your facility choice, you click continue, and that will start the auto build process from within that patient record. So already it is bringing me the form and it is pulling across the patient details of the test patient that I am in. So with most referrals, you will have an option to choose your specialist or to refer to the department to make an unnamed referral. Points of note for all of the HealthLink forms that are worth looking. A lot of them will contain these little I information buttons. What's of relevance here for this form is that you can choose your model of care, whether you with the mother-to-be, whether she wants a birth centre, a GP shared care, hospital-based care, or midwifery group practice. And just to back that up, we have elements of information about those particular models of care, should you be unfamiliar with them or just want some further advice on making that model decision. Whether it's not necessarily relevant on this particular form, but as a standard feature, you have a newer continuation option for the referral, and you can also choose the referral period as well. Again, not necessarily that relevant in the maternity section here. Should there be issues of language, you can indicate if the patient will need an interpreter on their first appointment. And again, if you click yes, that will auto-populate from any languages of preference within GP software. And you can, for other points, actually put in about some compensable status as well. Just click note of that. Now, in terms of the clinical information, a lot of the HealthLink forms will just give you the option to just put reason for referral. Will be very generic in its point. As this is maternity, we want to find out about as much information as possible, so we can do that booking part. So the first part will be urgent. If this is a late diagnosed pregnancy and time is of the essence, we are requesting that you tick urgent and provide an indicator and speak to either the duty midwife or the GP or the obs and gynae registrar. It's a particular note if your patient is plus 19 weeks and we need to get them in sooner for first appointment. And then we would request that you tick urgent in this case for that. So go through the pregnancy history, whether there's been multiple pregnancies before, number of previous pregnancies and births, estimated date of delivery, and the standard calendar function on there. We would greatly value having that, as it helps with first appointment scheduling, and last known monthly period, and pregnancy history, whether there has been previous history. By clicking yes, you then get the option of ticking off any of the events that may have occurred at previous pregnancy. If none of them occurred, it was a routine pregnancy, then obviously you wouldn't need to fill that in. I'll just close that. And at all points, you have an entry box then for free text information, and particularly about other medical history, other obstetric history. Then the form runs through standard thing about any investigations that you may have taken, etc., and about care and support information as well. If it doesn't pull across from your practice software, then we'd like that to be completed with that. Now, the other tabs that are relevant is attachments and reports. So any pathology and radiology that you have sitting behind the patient record will come across, and then you are required to just tick individually which are the most relevant pathology that you want to send across as part of that. And the same for radiology as well. Medical history, and the case then of ticking what is the most relevant that will transmit across as part of the referral. Obviously, broken toe at the age of 12 to a 38-year-old's prima-gravid one is probably not that relevant, so you wouldn't need to tick it. But obviously, all of the important ones about any chronic health, any gynae history at all with that. And the same then about smoking history from there. Patient information. Now, this is just the test patient, but across will come all of confirmation about residential address, Medicare eligibility, and numbers. Now, should you have a patient that doesn't have the pension number or Medicare number, you can actually just free text in 1234 just to get it to come across. So you can kind of fool the system there, because we are very much aware that not every patient holds a Medicare card, and we wouldn't want it to preclude a referral. So confirmation and a postal address, etc. All of that will come across. We do prefer that mobile phones and email addresses are attached if you have them in your practice record, and particularly for anybody that comes through as an eReferral, because that will allow us then to not only confirm acceptance of the referral with yourselves through the practice software, but we're then SMSing patients to tell them that their referral has been accepted, so we can enable further contacting about scheduling that appointment. And then finally is your practice details and your provider numbers, and this forms part of your electronic signature, so there is no need for you to print the referral off for signing, etc. Once all of that has been completed, you will then press submit over in the top right hand side, and if I'm going to send this, and it probably will tell me to do it. Oh, there are a lot of errors because we weren't completing as a test patient, but you will get an acknowledgement that will say your referral has been sent with a date stamp. And you can then save that referral into your practice software. Just on the subject of where the confirmations and the startup updates land back into your practice software. So for best practice, it lands in correspondence in. The copy of the referral sits in the correspondence out folder. For Genie, pretty similar in the correspondence log, and HealthLink forms have a special field within that. Medical director, just go to your letter tab and you will find a history of all the previous correspondence and the referrals that are signed off in through there. And for those using the portal, very similar to an Outlook or email dashboard, you will see all of those ongoing correspondence that you've had there will be recorded as in and out mail. And I'm going to hand back over now to Eric and Carmel. Thank you very much.
Awesome. Thank you, Paul. Okay, I'm just going to quickly show you best practice SR referrals to do a private specialist referral. So here I have best practice. This is a live system, and you need to open a patient record. So I'm just going to do a test patient. And that should open. And there we go. And to do an eReferral, excuse me, there's two ways we can go and look at the HealthLink forms. Click on HealthLink forms. That will load, and we just click on a new form, and that will then take us to the standard referral forms. There we go. And as you can see at the top here, as Paul showed us earlier, there's the SR Specialists and Referrals, and then there's all the other referral services that are available. And the other way to do exactly the same thing is, rather than going through your HealthLink forms, HealthLink have very nicely put an HL button at the top. So you click on that and that will open exactly the same form. And then you can click on Specialist Referrals to go to search for your specialist. So I'd like to now hand over to Carmel, who can show you how all this works in Medical Director. Are you there, Carmel?
Yes, hi Eric. And what I'm going to do is, well, I've already got a patient record open. So very similar to how Eric just showed you in Best Practice. You've got the HealthLink tab across your tabs here. So you just click on that and then into New Form. And again, it brings up the HealthLink landing page, and all you need to do is click on Refer to Private Specialists, the SR icon, and we're in. So this is the main landing page that you will see each time you go into HealthLink and into SR. And if you know the name of the specialist that you wish to refer to, all you need to do is start typing that name. And it's a good idea to start with the surname, just because you're less likely to have any spelling issues like Matthew instead of Matt, and abbreviations of names. So here's one here that we might go to. So we can bring up that specialist, and it will load all the information that we have about the specialist and the service. It does vary the depth of information, but there is more information being loaded all the time from the specialists. So just looking at the screen here, you've got the eRefer button. When you're ready to do a referral, you can add them to your frequently used. There is the ability to send an email through to your patients, which gives them a link to the same block of information about any individual specialist, but instead of opening it in SR, they open it on our Oz Health Pages website. So that just gives the patient a convenient way to see the specialist information, to click on the phone number and book their appointment and see all the contact details. So that's handy as well. And as we scroll down the page, we've got all the locations and the map as well. So on this specialist, if you wish to refer, you can go eRefer, and it brings up a drop-down pop-up which has all their locations, and you can choose the appropriate location for your particular patient. I'm not going to send one through to Matt because it is live and he'll get a real referral. So I'll just cancel from there and show you a couple of other things. So back on the main search, if you don't know the specialist that you wish to refer to, you can go in by category. And what we've done is we've grouped the categories. These are all the same categories that are in the book. And so you can just go cardiology related and put in the region that you'd like to search in. So for example, you could go North Sydney or whichever suburb that you're in. Go search. Now it does do a radius, which you can increase or decrease if you want to narrow or broaden the search. And this time, you notice on the results list that comes up, we've got the eRefer button, and then we've also got one which is manual refer. What that means is you can still click on that and then choose the location. And sometimes you'll see a mix of e and manual for some specialists, because one specialist centre might be set up for electronic and another might not be yet. Either way, you can still choose the manual location and it will still present the referral form just like an electronic one. The only difference is it will clearly say that you have to print off and fax it and that it's a manual referral, so it says it hasn't been sent electronically. But the process and the screen itself is exactly the same. I'll just go, and then scrolling down, the other thing to note here is that this is a referral through to the group records. Sometimes the referrals, you may go into one, like I'll just go into this one, you can still choose the individual specialists as well within that group. And sometimes the eRefer button will actually point you to the specialist list. And so here you can see the specialists. And instead of addressing it to St. Vincent's Heart, you can address it direct to that specialist and do the referral that way as well. So there's a few options in terms of where exactly you'd like the referral to land, and it's a good idea to get familiar with that. So back to the main search. Now we have set up a test specialist called earlobe. So I'll start typing in earlobe, and you can go and find earlobe or Mickey Mouse and do a practice referral if you'd like to the specialist. So it won't go to a real specialist, and it's a good way of just getting familiar with the referral form if that's helpful. So into here, and on this one we'll choose the eReferral address, And now we're into the standard HealthLink form. So this is very similar to what Paul was showing you before. The main difference is that it's a generic form, so you'll have the same form for all your referrals to this SR specialists, and it is a fairly straightforward form, so there's no sort of additional information that you have to fill in at this stage. So at the top is the specialist information. Then you've got the choice of a new or continuation, a change of the time frame. You can flag it as urgent, and then you have to put a reason in. The main field that is compulsory is the reason for patient referral. So you do need to enter some text in here, and you also have the option of browsing your consultation notes and inserting from there as well. So that can be handy. I don't have a real patient on here, so I don't have a lot of additional lab results and things that I can show you. But if you did have any investigations or lab results, you can go into attachment reports and it will bring up all the history. And again, you just need to tick the ones that are relevant for this particular referral, and you can actually preview as well if you're not sure. Sometimes the naming of forms isn't that obvious, and it will then pop it open. And this is actually a previous referral form, I'm guessing. So you can see here, and that's actually the format that the SR referral forms come out in as well. Just a sneak preview of another one that was there. So you can choose any that are relevant from there. You also have the option of browsing on your local computer. So if there was a photo that had been taken and sent through to you, or anything else that you've stored locally, you can also pick that up and include it in the referral as well. There are some notes up here about the file types that are acceptable, so keep an eye on that. And sometimes there can be issues with the file size. If you are having difficulty with this area, feel free to call either ourselves or HealthLink, and we can provide further assistance. And HealthLink is currently reviewing the file size limits, because obviously we'd like to see those increased as well. And now onto the next tab. So here you've got medications, allergies and warnings. So again, it's just a case of selecting what's relevant or unticking it, uncrossing it if it's not. So there's some information coming through here. Likewise on the history of long-term classifications and patient history. And then I'll just tick a couple of things so you can see them come through. Patient information, yes, it's a good idea to make sure that contact details and as much information here is included to feed through. And then finally, your own referrer information. Just a tip, make sure that your practice name has been filled in. We do see quite a few come through called main surgery. So obviously it's more helpful at the specialist end to see your actual practice name. And it does default to that if you haven't updated it. So that's very straightforward tabs to click through. And then over here, you've got the option of either submitting the referral straight away, previewing it, which brings up the display as the specialist will receive it. So you can just check it here basically. And then the final option is to park it. And you may wish to do that, for example, if you're waiting for some lab results, or if you get interrupted and you need to come back to it and spend more time on it later in the day. Now you'll notice down the bottom here where it's attached files, it's not actually displaying the X-ray, but it's saying that it's attached. And when this saves into the copy that you see in Medical Director and in Best Practice, currently it just includes the reference here, but it does actually come through in the main PDF that comes to the specialist. They're not including the full version here, partly on a space saving, so that you're not getting duplicate images and things being saved into your patient records and blowing out your size and space in the system. So just the tip there, but you can see that the attachment is referenced and included that way. If it's a manual referral, the attachments tab is grayed out and it will just tell you to print those off separately and send them along with the actual referral document. So it doesn't, again, because it's not storing these within the practice software, it's just referencing for you to add those to what you're sending through. And so the last step is to submit, and we can either do it over on the side or from your preview. So I'll just click submit. And straight away, HealthLink is processing that. And you can see it says form sent, it's flagged it as urgent, and it's now being processed through to the specialist. I'll just close from there. And back in your main HealthLink tab here, you can see the previous ones that have been sent through. I think this might be on the letter tab. So here you've got a history and also a couple of other tips. You can see just scrolling along, further information on that list. We've obviously sent a lot. We have very busy patients who need a lot of referrals as we do demos. And on the HealthLink tab, there's some information here too. So it actually shows the status as acknowledged. And it also shows, so if it's one that's a manual one, instead of the recipient EDI displaying here, it will say, I think it's print fax. So that's a clue also. And if you do, have I got time, Eric, to go back in and do a manual one? How are we going?
We've got about 20 minutes. So
yep. So I could do that quickly just to show you the difference. So, and just another couple of tips. So we do have our guides here. So if you do want to see further detailed information or a refresh and the screenshots just to help you, feel free to click on one of those and download them, and it has everything there as well. You've also got your recent searches. You can have some frequently used specialists if you choose to save those. And so we'll just go back into another category. So say we choose general surgery related. So you can start typing up here as well, and it will narrow down. And again, we'll type in our suburb. And you'll notice this time in the list, we also have the sidebar of all the related categories. So you can also just click through to narrow down the set that you're looking at as an option as well. So for example, I could go to breast surgery. And so you can see here. And if I go to do a manual referral, so I'll just click on this one. And it's clearly telling me that it's going to be manual. So the same tabs and process come up. So what this means is that the directory is complete and you do not have to back out of here and go back to your letter writer and do the referral a different way. You can actually follow the same process regardless of whether it's going to be sent electronically or manually. And of course, you've got up-to-date contact information on all your specialists. So again, it's a message up the top here, only eReferral support attachments. This referral recipient is unable to receive referrals electronically. And yeah, it's just making sure that you're aware as you do this referral. So again, you just need to drop in the reason, and it won't save the attachments on it. Medications and allergies are there. So it's exactly the same process. And when you click to see, notice here it isn't submit, it's actually print this time. So I'll do that. And again, it creates the referral PDF for you, so it's all ready to send. And it's asking if you want to open it, which we can do. So it is opening as a PDF. And you can see I haven't done that for a while. There it is. And up the top, this referral is to be printed and sent by fax or mail. So it's clearly distinguishing from one that's been sent electronically. So that's just to make it clear for you. And back on your patient record, just click back to there. When you click over to HealthLink, you'll see that that referral is in your list, and there it is as print fax. So that was a quick whiz through. I'll hand back to Eric, and by all means send through any questions, and I can easily recap on any of that in more detail if needed towards the end. All good, thank you.
Awesome, thank you, Carmel. So what I've done here is that I've come into the letter. I'll just back out of this one. So this is the incoming letters. Yep. And we have they're all unlinked. So that means they haven't been processed yet. So if I open, let me see this one here, which is Donald Duck, and there's more than one possible match. But what I'm looking for here is these three green ticks. So that means it's looking for the patient in the in your file that is matched on three pieces of information, and then all I have to do is link this referral to that patient. So if I click link, it does that, and then it goes on to the next one. The one I want to show you is this one here. So this one here is not linked in any way. So it's still a referral, but I haven't seen this patient before. So what I do is I click new, and then it creates a new patient file and populates the information from the eReferral. So all I need to do is save that and then link it, and that's done. And then it goes on to the next one. Very, very simple. Big time saver. And if there's any questions on that, please put them into the Q&A. So I'll just move along. Go back to my slides, if I can find them. There we go. And continue with the presentation. So how do you get set up for eReferrals? Well, you're probably already live. If you have HealthLink and Medical Director or HealthLink and Best Practice, you are live for SR and the LHD's HealthLink Smart Forms. There is nothing to set up or install. It's ready now for you to use it. If you don't have HealthLink or you're not on compatible software, we can help you get set up. If you need any support or training, our contact details will be at the end of the webinar, or you can simply contact the PHN and they'll put you through to us. We provide extensive free training for your staff and are happy to contact the private specialists you refer to so they can use SR as well. Whatever their workflow, we can help them integrate SR so you can both reap the rewards of electronic referrals that work. Our sole purpose is to help GPs and specialists, and we've been doing it for 30 years. We're sensitive to your requirements and admin processes, and our tools will make your life easier. Feel free to call or email us with queries or for training. Let us know if you have particular specialist practices that you'd like to see shift from faxes to eReferrals. Let us know and we can contact them and offer setup, support and training. Because it's a live system, it updates instantly. So if a specialist joins or leaves a clinic, if they change their contact details, if they add or remove consult locations, or if they're doing telehealth consults, as soon as we know, you know. And finally, we help specialists by providing basic entries in the directory for free. Specialists can improve the visibility of their entries by including information on their services, their photo, and be listed under multiple categories. Paid entries are annual and are a package entry in the medical specialist directory, SR and Oz Health pages that Carmel mentioned earlier. There is no charge for GPs to use this service. So thank you for your time. I think we've got about 10 minutes left for questions. I'll hand back to Alex and see if there are any.
Well, thank you, Eric. Thank you, Paul. Thank you, Carmel. And Paul, common question is, what is the footprint of GPs who can refer to the Sydney Local Health District? Where can they be practicing to be able to take advantage of the eReferrals to the Sydney Local Health District hospitals and facilities?
Okay, good question. Thank you, Alex. So we've made access to HealthLink for Sydney Local Health Districts right across the PHN. So we've not just looked at the LHD borders. So if you're a GP practicing in Southeast Sydney LHD, the St. Vincent's Network, etc., you will be able to access HealthLink and Sydney Local Health District referrals through HealthLink as part of your practice setup. We've done that because we are very much aware that we have a lot of cross-border traffic, particularly around the CBD and I suppose the more western parts of both of our catchment areas when we get into Beverly Hills, the Earlwoods, those sorts of areas. So it is open for that. And obviously, we know that patients who may reside within our LHD see GPs over the border. And should you be a GP then on more the northern Sydney side, for instance, if you do have a regular cohort of patients or regular users of a particular Sydney LHD service, we can actually organise with HealthLink to actually add you to, or add our availability to your HealthLink profile as well. And we've certainly been doing that since the release of the maternity forms at the end of April. We've added a lot of GP practices that are outside of the Sydney LHD domain, because we know that they are regular providers and regular referrers to our services. So if you are a practice that needs to have that connection, just either let the PHN digital health team know, or contact myself, and we can help HealthLink get that set up for you. So.
Thank you, Paul. There are still no open questions in the Q&A box, so I again encourage any participants to please write your questions. A second question would be for Eric and Carmel, and it would be very similar to what I posed to Paul. You know, what is your footprint in Sydney? How many specialists you have on your books in Sydney? And especially, it would be nice to know what is the turnaround for a response to the eReferrals.
So we've been publishing our directories for, I think we're coming up to the 23rd edition. So we make a real effort continually to add new specialists. And so our goal is very much to list all private specialists in Sydney. And in fact, we have been extending across the state. So we've just gone live in South and West Australia as well in the last couple of months. So if you know of someone who's not in our directory, by all means, just contact us, flick an email or a phone call through, and we will add them, because we're keen as to get them all live, and we are adding them all the time, and there is a lot there now. The majority are live for eReferral, so you will be able to find specialists you can e-refer to. And yeah, and so it's, and I guess the other key thing is that our focus is on the quality of information. So we are making updates all the time, and if you spot anything that's changed or that you think would be good for us to check, by all means let us know, and we're happy to do that as well. We have submissions coming through daily through our Oz Health Pages website, and we also provide logging support. So we send out reminder notifications to specialists. We're doing a lot of training on the specialist side around making them aware as they get their first referrals through the service. So that's a really part of the support that we provide as well. So we welcome any requests. It's our, you know, our core business. It's what we do day to day, and our team are very focused on that. Thank you.
Thank you, Carmel. I'm still waiting for the questions to come through, but so the next question will be for Paul. And Paul, obviously, you did release the maternity forms to the RPA in, I believe, late April, which totally changed the landscape, led to a huge increase in the number of referrals. Can you share with us what are some of the next forms that you're focusing on?
I certainly can, Alex, and thank you. And I just want to go back to the question you asked Carmel about how quickly responses come back for appointments. I think there's always that variability part to that, and that's time to triage, etc. So the most important thing is you get that instant acknowledgement that the referral has landed in the right place, and then obviously normal triage processes take it from there. And New South Wales as a whole is working towards a 5-day turnaround for triages over the next couple of years as a state initiative. So in terms of next services coming on to Sydney Local Health District's eReferral platform, so Canterbury Maternity, and also the midwifery group practice at Concord, which is a fairly new service. There'll still be no delivery service for babies at Concord. That will still occur at RPA in Canterbury, but we will be accepting electronic referrals to the midwifery group practice out of Concord. just for convenience for mothers to be, etc. So to save them traveling right across the district, we've got that new Concord service there. So endocrinology and diabetes at RPA will also be another major step coming forward, as will be a slightly different direction in eReferral, and that would be EPAS at RPA, which is the Early Pregnancy Assessment Service. It's almost an emergency service for pregnancy and gynecology, and so that will be an initiative that we're working on over the coming months to go with that. There will also be further forms for some of our allied health services, sleep services at Concord to replicate the service that's currently there at RPA. And we are busy working on neurosciences as well. We recently launched neurosurgery, which is the public access service at Concord Hospital. So there will be a lot more services to come on it over certainly the next 2 years. So with that.
Thank you, Paul. Our speakers and thank to everyone for attending. Please do not hesitate to contact us for any assistance with electronic referrals to either Sydney Local Health District or SR Specialists and Referrals.